Hello, today we will be discussing otitis externa, also known as swimmer's ear. This video is linked in regards to the young man who is on his high school swim team and came to the physician with severe pain of the ear, and ultimately the physician diagnosed him with otitis externa. Today we will be discussing the pathophysiology of otitis externa, treatment, eardrop administration and the correct way to do so, and also prevention. We will discuss prevention of otitis externa. The pathophysiology of otitis externa, it is a bacterial infection in most cases. Sometimes it can be deemed as a fungal infection. The type of bacteria that usually causes the infection we will discuss later on in the video. The reason why swimmers are most susceptible to this type of infection is because obviously they're in the water all the time. In a moist environment, bacteria loves to grow in a moist environment. Any damage to the skin lining of the outer ear can also cause an infection. Any trauma that happens, if there's an open wound of some sort, that can also cause an infection. And again, excessive moisture or swimming, that's why it is also known as swimmer's ear. So the types of bacteria and fungi are listed on the screen. Again, dark, warm, moist environment is ideal for bacterial growth. The Staph aureus, the Pseudomonas aeruginosa, and the Aspergillus. Those are the main ones. There are so many different types of bacteria that can be found when, if there's any drainage of the ear and it's cultured, it can be from different families of the bacteria. I wonder if any of these synchronized swimmers have ever been diagnosed with otitis externa. Who knows? Moving on. Prescription treatment. Sometimes treatment may not require a prescription, and there are different over-the-counter medications that can be used. We'll discuss those later. But specifically for prescription, there's acidic acid solutions, which is pictured there. Antibiotic eardrops, and the antibiotics can range from neomycin to gentamicin, polymycin. There's all kinds of different antibiotics that can be used depending on what type of bacteria is found, depending on if they do any tests or anything like that. Antifungal eardrops can also be used. Most of the cases, though, are of a bacterial nature. Administration of the eardrops. In this particular case, in the case study, apparently a family member is going to be helping the patient administer the eardrops, so we would definitely want to educate the patient's family on how to correctly do that. First and foremost, you always want to wash your hands before and after administration. And the rule of thumb is pulling the ear backward and downward for a child 3 years and under, and then for an adult or for a person over 3 years of age, we want to pull the ear backward and upward, and this is what will be for Jay's case. So this is what we will want to teach the family member that's going to be administering his eardrops. One thing that we need to definitely teach the family member and the patient as well is to never allow the tip of the bottle where you're administering the drops to touch any surface whatsoever, especially the ear, the infected ear, because we don't want to contaminate the bottle. And then, you end up having to get another bottle of medication because that one had been contaminated. Prevention, again, there is over-the-counter ear drying aids that can be used. This one's a really popular one, Swim Ear. The number one thing that is super easy to do that you can do if you're a swimmer or if you're, if you're in the water a whole lot for whatever reason, is to dry. You want to dry your ear canal. And what you can do is you can get a hair dryer, put it on the lowest setting, and just dry your ears after you get out of the pool and make sure that they're dry. If you are an avid swimmer and you're always in the pool and you're constantly swimming, or like, for instance, Jay, who's on the swim team, it would be a good idea for him to wear earplugs when he swims, just to keep the water out of his ear. And then, of course, if you are prone to these ear infections, a good idea to wear a shower cap when showering to cover your ears if you're not washing your hair, of course, just to keep the moisture from getting into your ear. And that concludes our otitis externa video. References are listed as well as photo credits. Thank you.